Welcome, everyone. Thank you for joining us for our webinar, Barriers to Palliative Care Access, a Caribbean Perspective. My name is Iana Woods, and I'm the Executive Director of End of Life Choices New York. End of Life Choices New York is a nonprofit with a mission to improve end-of-life care, expand end-of-life options, and promote healthcare equity at the end of life. We do this in a few ways. We pursue legal and legislative reform to expand options and enforce patient rights to a peaceful death. We educate the public and healthcare professionals on end-of-life topics. We provide free support to people who are preparing advance directives, caring for terminally ill loved ones, or who are approaching the end of life themselves. After the talk, there will be time to answer your questions. To ask a question, please type it into the Q&A box at any time. We will be recording this talk, and we will share a link with all of you once it's available. Closed captioning is available, and you may turn closed captioning on or off using the button on your screen, the CC button on your screen. So without further ado, I will introduce our speaker. I'm so excited to have her today, Dr. G. Leslie Reece. Dr. Reece is a Barbadian general practice and palliative care physician. She is currently the Assistant Medical Director of the Barbados Association of Palliative Care and chairs their education committee. Dr. Reece is a fervent advocate of palliative care and uses innovative channels like TikTok to educate others on the importance of this especially important but largely underrated area of medicine. Dr. Reece's philosophical beliefs focus on the importance of ensuring the best possible quality of life for patients, as well as a general view that we should all strive to ensure that we are fully living and not merely existing. It should be no surprise that Dr. Reece is also passionate about speaking, blogging, or vlogging to remind others to live life to the fullest. I would encourage you all to follow her on LinkedIn and other social media. And Dr. Reece, we are so excited to have you speak with us today, and I now turn it over to you.
Hi, Anna, thank you. Thanks for having me, and thanks everyone for attending. I hope that you take away lots from it. And I also look forward to sharing with you guys on your own experiences as far as palliative care goes. So we're looking at barriers to palliative care, the Caribbean perspective, and we're going to zone in on Barbados because that's where I'm from. That's where I grew up, and that's where I practice. Now, across the Caribbean, there's going to be a fairly wide difference in the availability of medical care and how sophisticated it becomes. So in places like Jamaica, Trinidad, Barbados, you tend to get a more sophisticated healthcare system. I'm not saying that it's a better healthcare system, but in terms of tertiary healthcare, the smaller islands such as St. Vincent, Dominica, St. Lucia, when they have an issue, they tend to have to send their patients over to one of the other 3 islands that I just mentioned for healthcare. And there's a similar pattern when it comes to palliative care, whereas you find well-developed palliative care programs in Trinidad and Jamaica for sure. In Barbados, it's not as well-developed, but hopefully we will get there. And in smaller islands, it's almost non-existent. So that's why I think it's important to give you guys an idea of what is going on in this part of the world. And if you can help, great. If not, just share your ideas with me. Next slide, please. So what is palliative care? For those of you who may not know or who may have misconceptions, which are rampant out there, palliative care is an approach that improves the quality of life of patients, both adults and children, and their families who are facing problems associated with life-threatening illness. It prevents and relieves suffering through the early identification, correct assessment, and treatment of pain and other problems, whether physical, psychosocial, or spiritual. So what's important to take away from this is that it's not just about pain relief. Palliative care deals with this physical as well as psychosocial, spiritual, existential issues that a patient may be experiencing. Next slide. And one of the major things that underpins this entire presentation is that palliative care is explicitly recognized by the World Health Organization under the Human Rights to Health, and providing palliative care should be considered an ethical duty for health professionals. So it begs the next question, which is why isn't everyone who needs palliative care getting it? And hopefully we'll be able to dig into that. Next slide, please. So the benefits of palliative care are myriad and they've been proven. Yet we have this problem where persons are not able to access it. Palliative care has been shown to increase the ability of patients' families to cope with and care for a loved one. We're not just talking about palliative care physicians or nurses, but when you have community volunteers who have been trained in basic palliative care skills, they're able to go into patients' homes, help the families, help to prevent things like caregiver burnout and so on. Palliative care reduces unwanted, unnecessary, and painful treatments or interventions, including ICU admissions. Very often we see patients who just want to be, for lack of a better term, left alone to live out the rest of their days until they pass. And the families may not want that. The conversation was never had. So you get a patient who is admitted to ICU. There are the costs that are associated with that, which are tremendous, especially compared to palliative care. Palliative care will improve patient and family satisfaction with care. That is absolutely proven. It will improve patients' responses to treatments with improvement in survival. We've seen sometimes survival increasing by as much as 1 year when patients receive quality palliative care, and especially when palliative care is started at the time of diagnosis, which is the ideal situation. And palliative care, of course, improves the patient's quality of life. Next slide. So the 5 Alls of palliative care, I'm not sure if any of you guys have heard of this. I learned it pretty recently myself in the fellowship that I'm currently doing. So we have the 5 Alls, all illnesses. This is to reiterate the point that palliative care is not just about cancer care. It's not just for cancer patients. Patients with any life-limiting illness can benefit from palliative care at all times. Palliative care, ideally, as I said before, should be initiated at the time of diagnosis of any life-threatening or terminal illness. Too often, especially here in my setting in Barbados, patients are referred when they only have weeks or even just a month to live. That's not good enough. Palliative care could be, you just saw the benefits, and it can be so beneficial to so many of these patients if it started early and continued until death and into bereavement. All dimensions of palliative, all dimensions, meaning that we are not just dealing with physical. As we said, we're dealing with psychological, emotional, the social and spiritual issues. In all settings, palliative care does not have to be relegated to just a hospital ward or a hospice. Palliative care can very well be administered in the home setting, in nursing homes, wherever the patient may be, palliative care can reach them. And in all nations, Caribbean included, there are too many countries in which palliative care is just not, it does not form a part of the primary healthcare system, which is quite unfortunate. And I'll describe for you what the situation is in Barbados. So we have free public healthcare in Barbados, which means that as long as you're a Barbadian citizen, regardless of your age, regardless of your background, regardless of your income or your financial status, you can receive free healthcare within our polyclinic system and our public healthcare, public hospital. We only have one public hospital on the island. Yet palliative care, if you want to receive palliative care in Barbados, you're going to pay for it because it's not included in the public health system. That's not good enough. That's something that I am seriously fighting to change because there are so many people who cannot afford palliative care in a private setting. There's so many people who, even though they may be able to afford it, may not be aware of it because it does not form a part of the primary healthcare system. So it doesn't come up in conversations with their primary care physicians, and that's truly unfortunate. Next slide, please. So the benefits to be derived from palliative care are proven, and palliative care programs should form a standard part of our healthcare delivery. The next slide. So the big question that we're answering today is, why are so many persons in the Caribbean and Barbados specifically having difficulty accessing palliative care? Next. So major barrier is lack of awareness. Just 1 hour before I came onto this presentation, I was going through my TikTok, as Anna told you. I do TikTok videos to educate on palliative care. And there was a video that I posted yesterday, and it was the first time that I posted for quite a while because I've been doing the fellowship. And there were comments on it from adults, persons older than me, who said they've never heard of palliative care. They have no idea what it is, what it involves. And that's something that we need to change. So there's a general lack of awareness about palliative care in Barbados. Lots of people have never heard the term before, or if they have heard the term, they think that it's only for cancer patients or it only involves pain management. And then it's not just laypersons who may have never heard of palliative care or be unaware of what it involves, but there are lots of health professionals out there who are just as clueless or lost when it comes to palliative care. Next slide. Doctors, my colleagues, are another barrier to palliative care. So many of my colleagues are not referring their patients for palliative care. As I said here, the majority of patients who are referred to me are actually hospice candidates because they're well within the last 6 months of their lives. This may be due to doctors' misconceptions about what palliative care is and what it involves, doctors' fears surrounding death and dying, doctors' reluctance to broach the subject of death and dying with their patients, so they're reluctant to discuss palliative care. And on this point, I want to say that this is very much a cultural thing in Barbados and perhaps across the Caribbean as well, where we try to avoid speaking about death and dying as much as possible. So if you have a patient who doesn't want to talk about it, who doesn't want to hear about it, you have a doctor who also doesn't want to talk about it, then it's never going to be brought up. And then there's a doctor's unawareness about the availability of palliative care in Barbados and not knowing how to actually make a referral or to whom they should refer patients. Next slide. Generally speaking, there is a lack of personnel in palliative care in Barbados. So I told you all that we have one public hospital, the Queen Elizabeth Hospital. There's no palliative care service or team within the QEH. We have an oncology team, and for the most part, the oncology doctors are expected to provide palliative care services to their patients who are cancer patients, as you would imagine. But many of them have not been formally trained in palliative care. On the ward where our cancer patients stay, many of the nurses have also not been trained in palliative care. And not to mention, it's a cancer ward. What about the patients throughout the hospital who can benefit from palliative care, but who don't have cancer? What about those patients? Next slide. So palliative care is a multidisciplinary approach that is used. So the team will comprise of doctors, nurses, physiotherapists, nutritionists, chaplains, the list goes on and on. We have these professionals living and working in Barbados. How many of them are actually trained in palliative care? How many of them will be comfortable seeing palliative patients? How many of them are even aware that their expertise has a place in palliative care treatment? So these are questions that need to be answered, and the answers need to be corrected and quickly. Next slide. So in Jamaica, they have a number of hospices. I actually went and visited some because I did some training in palliative care over there. So remember, I was saying that they are more advanced than we are as far as palliative care services go. In Barbados, we do not have a hospice. There has been much talk of having a hospice, but due to financial constraints, I'm told, is why we don't have one as yet. This brings us back to the point of education, because I'm sure that there must be some corporate body out there who is willing to contribute to the development of a hospice once they see the benefit that can be derived from it. So although 90% of palliative patients would prefer to die at home, that's not always a plausible occurrence. In Barbados, though we're a very small island, we still do have very rural locations. So you may have a patient who, let's say, lives in Martins Bay, St. John. Now, it may not seem so far if you look at it on a map, but the road work, the intricately woven network of roads that you have to take to get there, many of those roads may be in dire need of repair. So it makes it infeasible, especially if something happens to that patient in the dead of the night. No pun intended. Some patients' homes are just not suitable for medical care to be administered in the home for whatever reason, whether it's the size, whether it's the sanitation. And then costs associated with frequent home visits by a doctor or nurse may be prohibitive. Very often, the palliative patients that we see here may have sacral ulcers or so that require frequent dressings. So then that would be a problem as well. And the caregiver at home may be unable to assist simply because we've not done any community volunteer training in basic palliative care, basic patient care in the home. Next slide. Myths and stigma. This is a huge, huge barrier to palliative care. And just a few common ones I've mentioned where lots of patients think that once we refer to palliative care, then all hope is lost. We're giving up on you. We're not giving up on you. Palliative care actually confirms hope and affirms life as a part of death, death as a part of life, natural part of life. Palliative care is only about pain control. And we've said, that's so far from the truth. Palliative care or morphine may hasten death. This is a very, very, very common misconception here in Barbados, especially. And that's something that, through education, we can let others know that, there is a place for morphine in palliative care. It actually is on the list of the approved medications by the World Health Organization to be used in palliative care. And then there's patients who believe that they're too young to need palliative care. My youngest palliative care patient was 7 years old. None of us is too young or too old for palliative care. Next slide. So financial constraints. So yes, there's a cost associated with palliative care now because it's not available in our public health system. But those costs are still significantly less than a patient who had to be treated in ICU or even on a regular ward in hospital. Local insurance covers, but some elderly patients have had their coverage discontinued. That's quite a common thing in Barbados, where once you reach the age of 70, you lose your insurance coverage. Certain aspects of care may not be covered, such as seeing a dietitian or a counselor. If your insurance company deems that the index illness is pre-existing, they will not cover. And the limits of the insurance may have been exceeded if the illness has been a long-standing one. Next slide. So this is where the Barbados Association of Palliative Care, which I work with, this is where we try to assist as much as we can. So we depend on donations from private citizens and private sector businesses. And more recently, we started to get a subvention from the government of Barbados. But we rely heavily on educational events to try to educate the public and others about the importance of palliative care so that hopefully we can gain more financial support so that we can help more patients, because the majority of the patients who come through us are patients who require some degree of financial assistance. Next slide. So what can we do better? How are we going to solve these problems? Next. So education is key. Education, education, education. So basic training in palliative care as a routine element of all undergraduate medical education. So all training doctors, all training nurses should be exposed to palliative care. To some, we have 4 medical schools on the island, one of them being the University of the West Indies, the other 3 being offshore medical schools, and none of them to date have included palliative care as a part of their training. Public educational sessions, public service advertising across various forms of social media, specialized training in palliative care for allied health professionals, who I mentioned before, and our community volunteers, lay carers, the basic initial training in palliative care, because these are the people who are going to be delivering the majority of care within the community and a home setting. Next. Palliative care needs to be included as a part of the public health system. It needs to be included as a part of the continuum of care, so that as soon as somebody is diagnosed with a life-limiting or life-altering illness, they should be referred to palliative care. We need better access to medications which are necessary to administer quality palliative care. Very often, I may have a patient who is in the active phase of dying, who needs immediate release morphine, and the only morphine that I can get on the island is sustained release or slow release morphine. That's not good enough. What I will say is that I've never had a problem getting injectable forms of morphine, but that's not always the best route to go. So we need to have a constant supply of oral morphine in both formulations. Access to all aspects of palliative care, not just those related to physical symptoms. So we need to have access to spiritual leaders who can assist in palliative care, counselors, psychologists, the list goes on. Ethical guidance and policy making related to the provision of palliative care needs first to be established and enforced, and planning and funding for research to inform the development of economic policies relating to palliative care. Next. That's the end. Thank you. I'm open to your questions now.
Thank you so much. That was wonderful, Dr. Reece. So if you have questions, please put them in the chat. While we're waiting for those questions, I have a question for you, because I'm always curious about, you stress the importance of education. How did you start using TikTok, and how has it helped educate the community?
Okay, so I actually got onto TikTok during the start of the COVID pandemic last year, really out of boredom. And then I realized I saw other people using TikTok to educate others on their areas of expertise, not necessarily in medicine, but anything. And I thought to myself, there's so many people who don't have an idea about palliative care. So how about I use TikTok, mode of delivery that, is fun and delivers information in small chunks so that it's more digestible for the average person, and I'll be educating them as well.
Yeah, it's a wonderful tool. And you've gotten a lot of views of those videos, right?
Yes, I have.
That's wonderful.
And that's why I went over to LinkedIn as well, and the response there has been really great as well.
Fantastic. So everyone follow her on LinkedIn and TikTok. How do they find you on TikTok?
TikTok, my name is Dr. TikToker, DRTIKK. DIDRTIKTOKKER, Dr. TikToker.
Great. And then I think let me see, do we have a question here? Okay, sure. So here's a question for you. Have they added palliative care training to the colleges of nursing and medicine there?
No, they haven't. So I have a friend, my friend who actually got me into palliative care. He is a family physician and he lectures at the University of the West Indies here. And he was telling me about, the importance of including it in the curriculum there. So what he's been doing for his students is trying to sensitize them to palliative care. But as far as a formal palliative care educational setup where it's a course or part of a course, it's not being done as yet.
Okay.
And definitely not in nursing. I know that for sure.
Okay, I have another question here. Given the stigma around discussing death and dying, how can we go about starting these conversations?
So the thing is that lots of people believe that the person who's dying doesn't know that they're dying. And that's so far from the truth. They do know that they're dying. And so when we keep avoiding it, we kind of ostracize that person and make them feel as though, things are really, really grim and we don't want to talk about it. We don't want to deal with it. Just have the conversation, just start up. I remember when my grandmother was dying, even though I practiced palliative care, I felt strange to ask her, about dying and what she would want and so on. But I had to push past that. So I completely understand how it is for other people, because as I said, it's a very cultural thing. But I found that once I just started the conversation, and in that case, I started by asking her if she was afraid. And normally when I ask patients if they're afraid, they might say yes. And then I'd ask them what they're afraid of. But with her, I asked her if she was afraid, and she asked me, what do I have to be afraid of? So she was very much at peace with what was happening with her. And I find, and I keep saying to my friends and my colleagues, that more often than not, the average patient is at peace with their impending death. As far as patients who may not be so near to death, for whom, let's say, we've just diagnosed a serious illness, again, just bring it up. But bring it up in the context of, death is a part of life. We're all going to die. That's something that we can't avoid. But what we can help is the way that we die. We can help ourselves to have a dignified death. We can help ourselves to have as comfortable a death as possible. And that can start a conversation.
Mm-hmm. Thank you for that. And then we have another comment. Oh, someone just said they found your presentation really informative and she loves your TikTok videos. So you have a TikTok fan. And then there's a question, how do we get more of this information, palliative care out into the community so that more people are made aware? So what are your ideas for educating the community?
Well, using forums such as social media. Everybody's on social media now, even what the young people like to consider as the older folk. I know, right? But everybody's on social media. So even if it's not you who's creating a post like I would, if you see a post, you can share it. Mm-hmm. Right? So that's a really great way. Also, things like speaking at churches or printing out flyers and handing around to people in your church or any other community group that you're a part of will help to spread awareness and to educate to some degree.
Mm-hmm. Great. There's another question. Besides education for clinicians or aspiring clinicians, is there community-wide education for the consumers? Well, you just talked about this, church-wide educational sessions, culturally sensitive health fairs. So I guess you just tapped on this a little bit in terms of getting the community engaged. Um, and then here's another question. As case managers in New York, what can we do from your perspective to help awareness for the Caribbean population that resides here with family back home?
Well, similar things, going into their churches. I know Caribbean people love church. So going into churches and speaking to them about it.
Mhm.
Once again, social media, the same thing. Just keep keep throwing the message out there. You know, when we go to the store, we don't have to look in the Coca-Cola refrigerator to know that we want a Coke. The message is constantly being thrown at us, so it's automatically something that we think of. And similarly, I'm not saying that palliative care should be on our minds constantly, but for sure, there's nothing wrong with it being there so that when you go to the doctor, you can ask the doctor, well, you know, I've heard about this palliative care thing. How would that relate to me? How can that help me? Would I be able to benefit from that?
Mm-hmm. Definitely. And in New York too, I know there's a lot of cultural groups, professional organizations for Caribbean
Mhm.
professionals. So that probably can be a good way to go as well.
Yes.
Um, is there a way to offer an insight into palliative care course, like a certificate course? Do you know anything about any of the other kinds of educational opportunities?
Yes, actually. So if you visit pallium.ca, that's pallium.ca, it's a Canadian website. They do lots of online courses, ranging from the very, very basic that anyone can take, right up to a professional course that will actually give you a designation. So I find that that's a very, very helpful resource to use, pallium.ca.
Great. And I have to give a little plug for End of Life Choices New York. We are working on a end of life advocate certificate program that will be launched in the summer. It will have education about hospice, palliative care, and other end of life issues. So stay tuned, follow us, join our mailing list and all that so you can be aware of when that's launched.
That's
Um,
awesome.
we have another question. Have the faith leaders been supportive in terms of, you mentioned engaging churches. Have they been supportive of these efforts?
Yes, they have. I have to say that faith leaders in Barbados are very much into ensuring that their congregations are aware of all things health. So any health related matter, they're very welcoming to those who want to come in and speak to them. So yeah, they've been very, very open to it. Any church group that asks me to speak, I am more than willing to go, because the more people who hear the message, the better.
Mhm. Great. Another question. Someone said they really enjoyed your presentation and really enjoys your TikToks. Considering that palliative care isn't covered by the government of Barbados, do you think that's why some of your colleagues are reluctant to refer their patients to palliative care?
It could be, as you mentioned it could be, but my thing to that is that we should not assume that, somebody A will not be able to afford a particular course of therapy, and B, there are associations out there. So even if someone was not aware of the Barbados Association of Palliative Care, everyone is aware of, for instance, cancer support services. So they can put them onto cancer support services, even if the patient doesn't have cancer, who would then be able to direct them to the Barbados Association of Palliative Care. But thank you for this question, because again, it underpins the need for education and more awareness, especially as far as a referral pathway for patients goes.
Hmm. Yeah, thank you for that question. You mentioned earlier about needing financial support. How would someone go about supporting your efforts to expand palliative care? Is there a website we could donate to?
Sure. So yeah, so there is the Palliative, the Barbados Association of Palliative Care. Our website is barbadospalliative.org. That's barbadospalliative.org. And you can donate there. You can send an email to the president or to myself, and we will walk you through and tell you more about what the association does, what our needs are, and any little bit that you can offer, even whether it's financial or in kind, is quite helpful.
Oh, okay, great. So now, so another question. You mentioned advocating for policy changes, including getting palliative care paid for. What have these advocacy efforts look like, and any advice on how best to advocate?
Well, those advocacy efforts are in very, very, very infantile stages. I'd probably even say fetal. Um, but I'm more than happy to keep you guys posted on how it's going. We recently, or kind of recently, had a change in government, which would have changed the policymakers at the top. And then with COVID, that would have impacted quite a bit. I would say that right now, I am at a stage where I am accumulating as much information as possible to present to them, so that I have a firm case on which to stand on. I mean, I already know that I have a case, but it's to present it, right? But as I said, I'm more than happy to keep everyone posted on how it's going.
Great. Yeah, we wish you a lot of luck with that.
Thank you.
Looking, are there any additional questions in the chat? Wait a minute to give anyone else who has a thought they want to share. Isn't, I know in an earlier conversation, you mentioned that you've been getting international attention from your educational video. So not just within the West Indies and the States, but other countries. Can you tell us a little bit about that?
Yeah, so I've had some requests from Europe to speak in settings such as this. Yeah. Other parts of the Caribbean from you guys and other persons in North America. So it's been overwhelming, but in a good way, because you never really realize how far your message reaches until something like that happens. So I'm really glad the numbers of people who reach out to me and say, I never really understood what palliative care was until I saw your videos. Like, that's amazing to me, because not only have I told them about it, but they can go tell others. So yeah, it's really heartwarming, and I look forward to more of it. My aim is to be able to give a TED talk on palliative care.
Wonderful.
Um, so watch out for that. Keep watching the space.
Beautiful. It just goes to speak to the power of one person's voice and to make a change and educate the community. And then just curious about the impact of COVID in Barbados and palliative care, and kind of how that affected your work.
From a strictly palliative care perspective, it kind of slowed things down a lot, because many patients as normal were not being seen by their primary care physicians, or even in like surgical clinics and so on at the hospital. So referrals were down a lot. And that saddened me from the point of view that there were probably lots of patients out there who were not receiving palliative care simply because they weren't being referred. That has improved since things have kind of mellowed out now. We're not fully out of the woods, but certainly as far as practice goes, things are almost back to normal. But from the COVID perspective, I thought about palliative care for the patients who would have eventually died from COVID here. We had 47 deaths from COVID out of nearly 5,000 cases. And it was, at that time, I was not working with COVID patients. I am now. But it was heart-wrenching to think of persons dying without, even if not the physical aspects, because I would like to think that those would have been taken care of by the intensivists who were looking after the person, but from the psychological and spiritual aspects,
Mm,
like those persons may have died without having been benefited from those areas. And that was really heart-wrenching for me. But now I am working with COVID, so I can do more in that respect if the opportunity arises again.
mm, yeah, it's been rough. Another question is the only way to access palliative care through a referral?
No, it's not. If you have my number or if you have any of the telephone numbers of any of the other doctors, there are about 5 of us on the island who practice palliative care. You just reach out, you a family member, and we'll get the ball rolling. I don't need a referral. I just need to be able to get a hold of your notes and records and any reports for any tests that have been done, which, you know, doctors on Barbados are very friendly and very interactive with each other. So that's never really a problem.
Okay, great. Thank you for that question. Any other questions anyone else wants to share or ask Dr. Reece? A minute. Is there anything else you'd like to share with us today?
I have a question for the audience. If there are, especially those who are not in the Caribbean or in Barbados, are have any of the barriers that I highlighted common to you guys? Because I know even in a well-developed healthcare system, there still will be issues or inefficiencies. So I just wondered about that.
Yes, I would say all of the things that you pointed out earlier they came here, but perhaps if someone else wants to chime in the chat and share their experiences. So they know we have we have people who are in hospice on here, people in end of life care. Does anybody else want to share their thoughts about how what she presented kind of resonates with your work and your perspective? In a minute. Yeah, there's definitely the difficulty starting the conversation. There's a lack of education with healthcare professionals. Um, pretty much everything that you. Oh, here's a comment here. This person is from Tortola. Thank you for your most informative and timely presentation. I am the nurse at my healthcare facility, and I'm also very passionate about palliative care. Many doctors are very uncomfortable speaking with their clients about their condition and their short and long-term goals. Many patients are left in hospital for end-of-life care, and this is very taxing on the healthcare system. It is very important for team members to ensure that all palliative patients' needs are met individually, and the crucial conversations must occur so that the patients can be cared for at optimal level. Incorporating palliative care is part of the orientation and ongoing education in the healthcare facilities and in their homes, and will enable nurses, clinicians, and to do better care for all persons and their families. More countries in the region should seek to lobby with their governments and ministers of health to develop the best plan to improve healthcare delivery in this area.
I love that. Thank you.
Yeah, thank you for sharing that. Fantastic. Did anybody else want to? Oh, another attendee talks about from a Jamaican context. I have no idea that palliative care was a line of care until coming across Dr. Reece's videos. So I definitely think lack of education is a big issue.
Wow. Thank you.
Yeah, thank you for sharing that. Once again, it shows the power and impact of your voice and your creativity to kind of dancing around talking about all the myths. Perfect. Anybody else want to share anything as we kind of to a close? Lillian, did you have anything you wanted to share? Any questions?
Sure. One note that we got in the chat box is that there is a lack of trust in North American healthcare settings due to cultural differences. I would also add that there is a need of the American healthcare system to establish its trustworthiness. There have been a lot of things that have been done to either impede trust from developing at all or chipping away from trust as it comes about. And so that's also a big issue here. And I wonder, and I appreciate that comment. And to turn it into a question that I was thinking about too, is I wonder, outside of palliative care, in Barbados, what the perception or trust is like between folks that live there in the healthcare system.
Thank you for that question. I'm glad you asked it. It's actually the opposite. So patients tend to completely trust their healthcare providers here. It's almost a type of a paternalistic relationship. And it actually could be pretty annoying because sometimes they're so trusting. You might prescribe something for them and they just take it. They just take it. So if they go to another doctor and they're asked, what's this for? They don't know, but they're taking it just because their doctor gave it to them. And I mean, that speaks to the fact that either they weren't educated on it when they were given it, or they didn't understand, but didn't want to ask a question. But generally, there's huge trust in the Barbados healthcare setting as far as doctors go.
Thank you for sharing that. And so I wonder whether, thinking back to the advocacy piece, I love that you made an analogy to Coca-Cola and how, you don't have to see it to know that you may want it. And so in thinking of, I hate to apply this terminology to anything healthcare, but I can't think of a better word, the marketing of it. I wonder what role clinicians in other areas or other fields or specialties might play in branding or marketing palliative care. Have you heard of a case, kind of a success story of where this came up early and what factored into that happening? What factored into that going well?
I would say one of my best experiences since I started palliative care was a palliative patient that I had for a year and a half. And he had pancreatic CA, and he was only given 6 months to live. And I mean, he is proof that good quality palliative care does prolong life. But from the minute he was diagnosed, his primary care physician referred him to me. And it was just easy sailing. He continued to see me, he continued to see her. Any treatments he needed for the pancreatic cancer, he continued to get. So there was a nice synergy between everyone. I think a part of the problem, while there is great trust between patients and doctors in Barbados, there may not be that much trust between doctors and doctors here. So some doctors actually may view it as, you're trying to steal my patient, without understanding that, these two things go hand in hand, they go together. The patient will have palliative care services, but will also continue to see you for whatever disease modifying treatments you may need to administer. So I think that would be the problem.
That's such an interesting point. Oh, we got another note in the chat. Ayana, do you want to read that and I'll check the Q&A?
Sure. So the person says, I would like to receive more information on resources. I wrote down the link for the Pallium website, but I would like to be formally trained in this specialty. If you have any information on Caribbean nurses, sorry, this is my voice now. Excuse me. Caribbean nurses can be trained. I would like to receive this, please. So any other about Caribbean nurses, and I guess that could be within the states as well. There's a tremendous amount of Caribbean nurses in New York City.
Yeah. Well, what they could do is they could reach me on LinkedIn. Just search G Leslie, Lesley, Reece, and just shoot me a message. I'm more than happy to help.
And I see someone contributed about a training, the ELNEC training. Missy, can you write out what that stands for? So see if she can provide. But ELNEC training, she mentioned. It's the end of life nursing education training. So that's a resource people can look into.
We got another question in the Q&A, and I realized I didn't introduce myself. I'm Lily, and I'm the Director of Outreach and Education for End of Life Choices New York. I recognize some of the names, so I may have met some of you folks before, but just wanted to give a formal introduction there. So the question is, okay, when you actually get to see palliative care patients and overcome the first barrier, which you stated was that they are not being referred to you in the first place, what are other obstacles that you face in your work, and how can those barriers or obstacles be removed?
So some other obstacles that I may face are, as I said, most of the patients have come to terms with their diagnosis and the probable outcome, but then you have to deal with the family. Not every family is on board. Not every family wants their loved one to have palliative care. They may agree to palliative care, but then object to every single what's the word that I want? Every single thing that you try to do, they're going to object to it. So that's a major barrier. Another barrier is other doctors who the patient may see not understanding palliative care and the reason that we do some of the things that we do and the reasons that we don't do some of the things that we don't do. So then you get this clash in terms of the care and some confusion on the part of the patient, which obviously can lead to frustration. I would say those tend to be the largest barriers. For the most part, here, as I said, we have a pool of allied health professionals which you would need in palliative care, and many of them have attended our seminars and our webinars put on by the Barbados Association of Palliative Care. So they have at least some basic training in palliative care. So our patients are generally very well taken care of, but the biggest hurdle, the biggest obstacle is actually getting them into the palliative care system in the first place.
Thank you. I see that Roberta included her contact information, so maybe someone can reach out. Perhaps Missy, you can email her that information she's looking for. Okay, we have 5 minutes left. Wanted to give an opportunity for anybody else to ask any other additional questions, but in the meantime, I just wanted to thank you again, Dr. Reece. Thank you for spending an hour with us today and sharing all that really interesting, important information. Thank you for all the work that you've been doing on social media. Thank you for being you. You're a tremendous light in the world, and I know you're improving people's end-of-life care and helping to reduce pain and suffering. So we really appreciate everything you've been doing this past crazy year and a half during COVID. It's just really been an opportunity for you to get the message out, and we really appreciate you. So thank you.
You're welcome. Thank you. Thank you so much.
Oh, we have one more last question. So should these decisions not be discussed before a patient is in crisis? Is there outreach to encourage folks to complete advanced directives while still in good health? And definitely End of Life Choices is working to educate communities pre-crisis, just so they have information there, have familiarity with the terms. Can you speak? You were talking about churches as a kind of a form to get the terminology out there. Any other thoughts about getting younger people involved, people before they're sick?
So, right. So that's a part of what our outreach involves, is speaking to persons before they're sick and before they have loved ones who are sick, so that they understand, this is something that could happen to you. This is something that you want to think about now when everything's fine, as opposed to, as that person said, when you're in crisis and your mind just isn't working quite the same way. What I will say about advanced directives is that in Barbados, we don't have any legal framework for advanced directives. So a person may have advanced directives, but if they're challenged, then they may not hold up in the court of law here. But that's another barrier that we need to overcome and have corrected with the development of palliative care on the island.
And so, we have the healthcare agent, the person you designate in your healthcare proxy form. Do you have anything like that where they would be designated someone to make decisions on their behalf?
Yeah, you would have to designate a power of attorney
Okay.
for healthcare purposes specifically. So lots of people have a power of attorney, but that's mostly for financial aspects. And they don't realize that they actually needed to have a power of attorney for medical and health as well.
Interesting. Okay. And so I'm thinking of Caribbean folks coming to New York really would have no familiarity with the concept of it.
Exactly. Yep.
Okay. So that's something for us to consider as we engage in the
Yeah.
community. Important.
Mhm.
Wonderful. Okay. I don't see any additional questions in the chat. I think we've all been answered. So thank you again. Thank you so much. Really appreciate it. And I know you shared your email. Can you share it one more time for folks and how they can follow you and be in touch and engaged with you in your work?
Sure. So I'm on LinkedIn. I'm G Leslie, Lesley, Reece, Recce. You can email me as well, leslie.reece, lesley.recce@gmail.com.
Fantastic. Thank you so much. All right.
Thank you too.
All right. Take care. Thank you for joining us today, everyone.
Bye.
Bye.